So the next thing we're gonna do though is work on doing some sub-Q fluid, which is kind of a difficult thing, I'm not going to lie. And what we're gonna do first is we gotta get him to kind of settle down a little bit. We're gonna set him on this towel for right now and just try to keep him calm. And then I've got normal saline here. These are both 10 cc syringes of sterile normal saline. And what we're going to do is go ahead and open them up. I like to have them both open and ready so that I'm not putting him through more trauma, picking him up and like him getting away or anything like that. And then I have a sterile needle tip here. This is a 21 gauge needle, which is pretty small, but still kind of painful. I always feel really bad doing this. So we're gonna connect by taking this little cap off of the syringe, connect the needle to there. Because I'm right-handed, prefer to work with him facing my left. I usually kind of cover his eyes so he doesn't really know where he's going in that case. And what you're gonna do is really carefully pull up the scruff of the back of his neck here, and there's going to be a little bit of a triangle like this. And what I'm aiming to do is put the fluid in right at the base of that triangle, not deeply. You're going to feel a poke of the skin, and then you're going to pull back, make sure that you're not in a blood vessel or anything like that, and then start injecting the fluids. You want to be careful not to inject yourself. So I'm advancing gently, waiting to feel the pop of his skin. Okay. He's very furry, so it's a little bit challenging sometimes. Okay, I think I felt that go in. You want to be careful to move with him because you don't want this needle to be pushed into him. So now I'm going to pull back on the syringe, make sure that I don't see any blood come back or anything like that. I'm trying to stabilize my hand against the rabbit, and I'm going to start to slowly push some of the fluid in. All the while I'm looking to see if fluid is running down from his skin, because that would be an indication that the fluid's not going underneath his skin but just on top of his skin, and that your needle is no longer in. See how he moved right there? I decided to pull the needle back so that he didn't accidentally stab himself more with this needle. That would hurt him a lot. And I can feel that some of the fluid did go in underneath the skin. It feels like a little kind of just like a little bit of a marble underneath there. So I'm going to go ahead and try and do the rest of this. Obviously, the whole time you want to be really careful. You're using a needle, so I don't want to see anybody else get stuck. And obviously, we're going to try and do this as gently as we possibly can for the rabbit too. Okay, so I put it in. I pulled it back to make sure it's not in a blood vessel anywhere. I'm advancing slowly, watching the signs of the rabbit, making sure that he's doing okay, making sure that fluid's not coming out. Okay, so that's the first little bit there, and some of it did seem to come out. That's okay. We're going to gently massage that in. I'm going to cover up his eyes again so that he's not interested in hopping away or trying to get away. Obviously, this isn't really that fun for him. So I'm going to repeat this process one more time so that I have 20 cc's of normal saline in him under his tissue. When I believe all the saline is injected, I do try to massage it in for him a little bit just so that it gets worked in, and I think it, helps him feel a little bit better as well. The other thing that is important to do is make sure that you're writing down all of the things that you're doing and the times that you're doing them, so that when you have to go to the vet, if he doesn't improve, the vet has a better understanding of what treatments have already happened and how long it's been since the treatments were begun. There's a notebook in the drawer on the right side of the white cabinet for that.